obvious inference there. Okay, so welcome to the YouTube channel. We're going through some of our frequently asked questions videos on today's topic of what is a root canal, or what is root canal filling. The root canal is the tunnel that runs through the centre of the tooth and contains in a live healthy tooth contains the pulp, which is a collection of blood vessels and nerves which supply the tooth. Once bacteria get into the root canal through either a cavity or a crack, then they can harm the nerve which we feel as toothache. Decay or cavities, cracks in the enamel are the two commonest ways that bacteria get into the tooth. When do we need to do a root canal filling? A root canal filling is usually needed when the pulp or nerve in the tooth, the central part here, is dead or dying. A dying nerve will often cause toothache that is associated with pain or hot and cold and can be very painful. A dead nerve can eventually lead to a dental abscess. So let's have a look and see what the X-ray tells us. Here we can see a large filling, here we see the pulp chamber, here we see the root canals, and then here we see these dark shadows which represent an area of infection around this tooth. So what does a root canal filling do? A root canal filling is actually a process of cleaning and disinfecting the whole of the root pathway before it's sealed shut, so no new bacteria can get inside that cause further infection. Again, let's have a look at what the X-ray is telling us. Here we've replaced the amalgam filling with a central fibre reinforced core, which gives greater strength to the tooth, and here we see well condensed root canal fillings extending all the way to the tip of the root. So do they work? Well, root canal fillings have an exceptionally high success rate, but they need to be completed under ideal conditions. So they need to be done right, and then they have a very long-term success. Sorry about that, that was gibberish. So what does the radiograph show us? Here we say the tooth has been restored with a crown, so a cast restoration to go on top, which acts like a crash helmet to hold it together. We've left the fibre core intact. Here's our root canal fillings, and we can see the dark shadows have gone, which means the area has healed and the infection has cleared up. So we've got an ideal result. We've gone from an infected, painful tooth that's at risk of extraction to an infection-free, comfortable tooth that's ready to work for many more years. So do they hurt? No. Toothache and dental abscesses can be extremely painful, but a root canal filling, when done correctly, should not be painful at all. How many roots are there in a tooth? The number of canals varies from tooth to tooth, but as a general rule, the farther back we go in the mouth, the more canals we see. So in this tooth we're seeing 4 canals here, and that'd be normal for a molar tooth, but near the front we might see 1 or 2 canals. Here we see the canals filled. So why do they take so long? A root canal filling can take a couple of hours to complete, and that's because the canals are very small, they can be narrow, and they can be quite curved, and can be quite difficult to find and to get all the way down. So we see various different shapes to canals. We can see here canals splitting in 2 later on in the canal. We can see curves around canals. We can see little side canals out the side. They can all be very tricky to approach, the multiple canals here. So these all need to be cleaned and shaped, and it takes time. Does a root canal treated tooth always need a crown? And here the short answer is no, but again, the farther back in the mouth we go and the more damaged the tooth is, then the more likely we are to need a crown. So on this occasion, we've done our root canal filling, we've got a fibre reinforced core, this is a temporary crown on top. Here we've created a shape onto which the crown will fit, so we see that this is the fibre reinforced core and this is the shape around the tooth. And there we see the crown in place, which has restored the tooth back to full form and function. Thanks for listening. Hopefully that's explained a little bit about root canal work. If you'd like to know more about us, then you can visit us on our website or see some more of our videos on our YouTube channel.